Hey guys, so today I'm gonna be going through the Molluscum contagiosum. This is a viral disease. So let's start with the cause. So the cause of this disease is the Molluscum contagiosum virus. This is a large double-stranded DNA virus. It replicates entirely within the cytoplasm of the keratinocytes. And this is a member of family Poxviridae. So we have four main types of the MCV. These are 1, 2, 3 and 4. MCV1 is most common cause of the molluscum contagiosum and MCV2 is seen in the adults and the HIV patients. And 3 and 4 they are very rare subtypes. So whenever any patient comes with the molluscum contagiosum, the most common cause of that is MCV1. How it gets transmitted? So it gets transmitted by the fomites, by the auto inoculation. So whenever the person maybe is having on the hands, and the person can get infected by himself or herself only by scratching, or it could be secondary to shaving. And transmission is very common in the wrestlers, the steam and sauna bathers, and the people who are playing the contact sports, for example wrestling, football or rugby. Manifestations. So molluscum contagiosum is manifested as papules and the size of these are 2 to 5 mm. They are 2 to 5 mm in diameter and they are slightly umbilicated. Umbilicated means you may see here these are like depressed in the middle. So the center is depressed and the sides are up like this. Okay, and you can see here. So they are slightly umbilicated. They are flesh colored. Flesh colored means the skin colored. So the skin of this thing and this thing, these both are same, and they are dome in shape. So the different shape they have the features of like slightly different from everyone else, like the slightly umbilicated. Maybe the umbilication happens in other diseases as well. We will talk about them in the differentials. But they are flesh colored, they are dome shaped. These are specific for the molluscum contagiosum, and these are papules, and the size you should remember. Generally, they involve the pubic and the genital areas in the adults, but it can happen anywhere. It can appear anywhere in the body, but never on the palms and never on the soles. So this is how they look. They are mainly in the pubic and genital areas, but they can occur anywhere in the body. So molluscum contagiosum can occur in the children as well. The genital molluscum contagiosum is very common in the children, but it's not associated with the sexual abuse. But if there is history or there is physical examination findings of sexual abuse, in that case the other appropriate referrals should be undertaken. So as I told you, it could happen anywhere on the body. It could be on the face, it could be on the body, and it may resemble other diseases such as chickenpox. To diagnose that, we have to go through some diagnostic tests to differentiate between other diseases and the molluscum contagiosum. This could be the examinations, the general inspection. Other than that, the diagnostic investigations could be potassium hydroxide preparation. We should take the material, the soft material from the umbilicated part of the lesion, and that should show inclusion bodies. In the other name for that is molluscum bodies. Within the keratinocytes, these can be seen. So the histological diagnostic tests can be done. In the differential diagnosis, we can involve the warts and the herpes simplex. In the herpes simplex, we have HSV1 and HSV2. HSV1 when we have the vesicles and the herpes simplex upper than the waist, and HSV2 below the waist. So generally this can resemble because the umbilication happens in the herpes simplex as well as in the molluscum contagiosum, so that they can be differentiated by the diagnostic tests only. But by the inspection or by the general how they look the same because they are both umbilicated. And the second one we have is wart. So warts, if the growing area warts are there, that's mainly associated with the HPV virus. So these warts may get larger, but the molluscum contagiosum papules will never get larger as the warts. So this could be the differential thing in between both of them. Let's see the treatment. So the most effective and most appropriate treatment is the curettage. So we can remove the papules, these small papules, by the curettage, and we can do the curettage with or without the administration of the local anesthetic. And the bleeding will of course be there. That could be controlled with the gauze pressure or Monsel's solution. Some OTC treatments are also available like molluscum RX and Zymodum, but they are not so effective. Some other treatments are cryotherapy with nitrogen, antivirals, immunomodulatory therapies, trichloroacetic acid peel, and laser therapy. At the end, what are the do's and don'ts for the molluscum contagiosum care? Do wash your hands frequently. Do wash clothing areas in the damp water, in the warm water. Do avoid direct contacts. Do seek treatment if you see the papules. Don't share swimsuits or towels if you have the symptoms, if you have the papules. Don't scratch over them. Don't share helmets and gloves with anyone. And don't participate in direct contact sports. That's all about molluscum. See you in the next one.